Are there risks with NSAID use for seniors with arthritis? Are you wondering if there are risks associated with using non-steroidal anti-inflammatory drugs for seniors dealing with arthritis? You're not alone. Many people seek relief from arthritis pain, but it's important to understand the potential risks involved, especially for older adults. Non-steroidal anti-inflammatory drugs can indeed help reduce pain and inflammation. However, their use in seniors requires careful consideration due to several possible side effects. One major concern is the increased risk of gastrointestinal problems. Seniors are more likely to experience issues like peptic ulcers and gastrointestinal bleeding. If someone has a history of ulcers or is taking other medications, such as corticosteroids or blood thinners, this risk can be even higher. Kidney function is another area of concern. Older adults may be more susceptible to acute kidney injury and chronic kidney disease when using these medications. This risk is especially pronounced for those who already have kidney issues or conditions like heart failure or high blood pressure. Cardiovascular risks also come into play. Studies have shown that non-steroidal anti-inflammatory drugs can raise the chances of heart attacks, strokes, and other cardiovascular events. This risk tends to be greater in elderly patients, particularly those over 80 years old or with pre-existing heart conditions. Long-term use of these medications may not be the best option for seniors with arthritis. Some research indicates that prolonged use could worsen symptoms and increase the likelihood of needing joint replacement surgery. This is because long-term non-steroidal anti-inflammatory drug use might accelerate symptom progression without effectively preventing joint damage. To help minimize these risks, healthcare providers often recommend using the lowest effective dose for the shortest duration possible. For mild to moderate arthritis pain, alternatives like acetaminophen may be suggested instead. If non-steroidal anti-inflammatory drugs are necessary, doctors might prescribe protective medications, such as proton pump inhibitors, to help reduce gastrointestinal complications. In summary, while non-steroidal anti-inflammatory drugs can provide relief for arthritis pain in seniors, they come with increased risks of gastrointestinal bleeding, kidney damage, and cardiovascular events. It is essential for healthcare providers to assess individual health conditions and closely monitor patients to balance the benefits and risks of these medications.